Hi, everyone. I'm again Dr. Maggie Kang. I'm a mom caregiver to Nell Choi, who has NMOSD. I'm honored to welcome you to this panel on achieving health equity. And this is again grateful to the Sumayer Foundation for hosting this event. Right now, we are going to shine a light on how identity, race, gender, and access to care shapes the experiences of those living with these rare complex diseases. And I'd really like to sort of frame this conversation around this central question. How can we make the experiences of those living with NMOSD and MOGAD more equitable, more inclusive, and more effective for everyone? We are joined by an incredible group of panelists, both patients and physicians, who bring their lived expertise and medical knowledge to this topic. Let's get started with brief introductions. Dr. Choi, do you want to get started?
Sure. I introduced myself earlier to the group. I am a gastroenterologist. I practice out of Prince William County. If anyone's from Manassas, Gainesville, or Warrenton, that's where I practice. And Manassas is a largely Hispanic community that I treat. And then, I would say that further going west is more rural. So we do see some economic disparities in our patient population. And our group still sees Medicaid patients. A lot of specialists don't. So I'll just frame it like that and then allow everyone else to introduce themselves. Happy to be here.
My name is Luis Manrique Trujillo. I'm a neurologist. I work in different places. I work in Georgetown, Chevy Chase. Actually, I work in Woodbridge, Virginia, in Centara, so in Prince William County as well. So a very broad spectrum of neurological disease I see. But my main subspecialty is multiple sclerosis and NMOSD. So about 80 to 90% of the patients I see in Georgetown and Chevy Chase are patients with MS and MS-related disorders, including NMOSD and MOGAD. One of my interests has been research in health inequities, more specifically with Dr. Shin. Actually, we did a project, Dr. Shin, Dr. Osborne, many of my mentors, we focus on the Hispanic patients that had MS in our MS center. This was when I was a fellow, and we found very interesting results as well.
We'll get to that, yeah.
Hello again, friends. Again, my name is Uneka King. I've diagnosed with NMO in 2020, and I am part of the MedStar network. Great network. I will have people going to see this. Yeah. Can I get paid for advertisement? Oh. MedStar is a great group, so thank you.
Hello, everyone. My name is Johane Joseph. Some places you can find me as Pierre Joseph, as Pierre is my first name. I was diagnosed with NMOSD in 2006. And my first experience with any attack with NMO was in 2002. So it took me a while to get diagnosed. I'm from Venezuela. And now I've been living in the United States since 2005. So I've gone through medical systems from Boston all the way down, all the way to Maryland. It's a pleasure to meet you all.
All right, well, I'd love to get started from the patient perspective. And so, Joanne, do you want to share with us a time that you have maybe been dismissed or misinterpreted in healthcare?
Many times, especially with experience with pain management. As you all might know, women of color are dismissed more proportionately than other demographics. I had like chronic headaches after being blind on both eyes with optic neuritis, and to the point that every step was like my head was exploding. I had chronic back pain 24/7 for years and years, and none of the medications really help. And right now, I'm not taking any of the opioids or anything like that anymore. And trying to get the pain really managed holistically is so hard. It's something that people will see you and say, oh no, you don't look sick, you don't look like you're in pain. And inside you're like, I can't do it anymore, I cannot move, like I need to be in bed, or I need to sit down and that's it, and relax. But I find that the more you move, the things like acupuncture or dry needling, those are things that have helped me like tremendously in the last few years.
So when you said that you presented with the pain, the massive headache and the back pain, how did your healthcare provider respond?
They already said that, okay, you just need to relax, so just go home and, try meditation, something that I really love, but it didn't take the pain away. I had pain behind my neck, like I think somebody mentioned that. And to this day, I still have that same pain behind my neck, and it was never resolved. But I just try to ignore it. And I find that with pain, I sometimes fall into that pattern of trying to ignore it because I cannot find a solution with the health providers that I have, and especially if they treat you like you're a person that's seeking drugs, or a person that you just need to do something else and try to relax and not think about whatever diagnosis you have.
Yeah, I think you're speaking to something that's very real. I think the pain bias is a well-documented phenomenon that happens, particularly against Black Americans and women who present with pain. There's, I think, a false perception that Black Americans are either drug-seeking or they have a higher tolerance for pain, and women are just crazy and just over-dramatizing their pain. So I've heard this story so many times, but it is also researched and fully documented. So I'm sorry that happened to you.
Yeah, you get frustrated, you get tired, and sometimes you don't even know what to do anymore. But like somebody says, you keep going. There's hope. There's more to life than what you're going through. I have a vascular necrosis of both hips, but due to the steroids that I had to use. So that was a pain that even a bump with the car or just driving in the car, I couldn't sit in the car. And dealing with that pain, I had to have one replacement, and now I'm feeling the other. And my doctor doesn't want to prescribe opioids, something that I don't like anyway, because of my breathing issues tends to, like having an infection with COVID and all that. And so they don't want my system to my breathing to slow.
I see. Well, I'm sorry. I think a lot of patients often have pain undertreated in situations like that, and that obviously is so uncomfortable and so frustrating. But also the psychological wounds that you carry after an experience like that has got to be pretty hard. Dr. Manrinque, can you help us to understand sort of the bias in healthcare and how that sort of impacts people of color and women and people of less socioeconomic privilege in getting to their rare disease diagnosis?
So implicit bias that we are facing with many different conditions in medicine is ginormous. So one of the main things that we found when we were studying our patients with MS is that we are not really categorizing or classifying our patients very well in terms of race and ethnicity. And this has been an issue that has been reported in other diseases, but in our center more specifically, we found that only 1 out of 4 Hispanic patients were correctly identified in the EMR. So when you see the large epidemiological studies in the country, mainly coming from Kaiser Permanente and University of Maryland, they base their race and ethnicity data coming from EMR. So the first question for us is, are we really counting patients with these conditions? Now for NMOSD is even more challenging because the prevalence is even lower than for MS. So are we really counting every single patient, like not only diagnosing them? These are patients that have the diagnosis code in the EMR, but after they are diagnosed, are we counting correctly what is their race and ethnicity for us to say that there is certain trend for patients to develop these diseases or no? And I'm going back, I'm talking about this point because many of us, when we were in med school, they will say that MS was mainly a white, middle-aged woman disease. So it turns out that that's not really true. Actually, there are more recent studies showing that Black and white patients have similar prevalence and incidence of MS. So still, Hispanic patients are supposed to somehow being protected from that. So what we're trying to figure out is, like, are we really counting them, right? Because that goes back to our medical education. So when we have a stereotype of a disease, then when someone who doesn't fit that stereotype comes to our office, simply it's going to be like a no-go, right? Like, there's no way you have that disease. So when you think biologically how NMOSD and MOGAD develops, it is based on the immune system. Sure, the immune system has to do with genetic information, right? So those genes maybe come from our ancestors. But on the other hand, all you need to develop these diseases is an immune system that becomes overactive. So I feel like, back to your question about how biases affect our patients. So that's number one. We're probably delaying diagnosis in patients that don't fit our stereotypes that we were taught in med school. And then that is just like a dominoes effect, right? That goes all around the healthcare system, not only healthcare providers, but insurance companies and everyone else, right? So it's a ripple effect. So that's what we need to become better at, like finding out what are the risk factors, how we are diagnosing our patients, and then trying to fight those biases that are affecting our patients.
Right, and I guess, like, specifically for MS, like you said, a lot of times in earlier education, we were taught that that's primarily for Northern European patients. And so I can see how in that scenario, Latino patients would be underdiagnosed or have a delayed diagnosis. And in a disease like NMOSD and MOGAD, where it's just not well known, generally speaking. So I can understand how in both scenarios, education and awareness become very important in management. So thank you for that. And I know, like, when I talk about this sort of diversity, equity, inclusion, I feel like there's so much to talk about, but I like to break it down in sort of 3 categories or tiers, if you will, like the systemic barriers, and then there's like the conscious and unconscious bias of healthcare providers, and then there is patient empowerment. And so I would like to then direct the next question to Uneka, because I know that you have made some very conscious decisions about how you get your health care. And if you could tell us a little bit more about that journey and why.
Sure. So as we all can see, I'm Black. Oh, no, I'm not. I'm human. You're so darling. I love it. But I highlight that to kind of point out that I grew up and still currently live in a predominantly Black neighborhood. And yes, we're fortunate enough to have all of these healthcare facilities. But there's a little stigma about the quality of healthcare providers in predominantly minority neighborhoods, as well as the bedside manner, right? So I've experienced going to doctors in my neighborhood and either not getting the best care from the beginning when I check in with the front desk staff, all the way to having 5 minutes of my doctor's time, them barely looking at me and then kind of going on to the next patient. So when I started working and could be on my own healthcare insurance, not my dad's, and kind of navigate things on my own, I then started making more conscious decisions about the healthcare providers that I took on. So kind of treating it like a dating experience, right? It's like, all right, let's do a consultation, friends. Let's talk, right? The way you engage with me will be an indicator of how you will treat whatever conditions or just overall health that we kind of navigate here together. And so with that, being able to be an adult, make those conscious decisions, but also having, a really good job, having access to great health care in terms of insurance, really kind of boosted, the type of experience and the positivity that they've been able to navigate in it, right? I hype MedStar because, I've kind of been with them since I've transitioned to my current insurance. And what I love most, obviously, is, the interconnectedness of the network. So all of my doctors being able to talk to each other with no problems. Nobody has to fax. For anybody who does, it's enough people in here know what a fax machine is. I have to fax my medical records every time I see a new doctor after every appointment, trying to make them connect. Like, I appreciate that the most, but I also just appreciate the overall knowledge of a lot of the doctors in the MedStar network. Just recently transitioned my primary care doctor. She is amazing. Dr. Jensen, if y'all know her, give her a pat on the back. And so for all of that, it's really made, for me, this experience truly eye-opening to some of the challenges that folks who look like me typically face, right? When they don't have the wherewithal to be able to navigate the medical system. Y'all speak in Latin. Most of us don't know Latin. We have no idea what you're talking about half the time. And then also just not having the high-quality health insurance and being able to, it's couple of things, right? I work at a nonprofit, so we talk about access barriers a lot, right? Travel is another one. I don't drive, but I'm making my mission to go all the way to Friendship Heights so that I can get my, my infusion treatments every 6 months, see Dr. Osborne in between those things. But a lot of folks don't have the means to do that. They don't have, the money to be able to call a car or be able to navigate Metro. Even navigating Metro is like a huge deal. And so having the experience that I've had just makes me more appreciative of not having so many barriers that, that I can kind of solve for, right? For some people, it's way more challenging, but these barriers that I've been able to navigate, they've been easy for me, which kind of makes my journey easier because each day I don't know, how my condition will progress, right? So I like not having to worry about things like, how am I going to get to the doctor?
Yeah, thank you for sharing that. And I'm so glad that you have found an option for you that works for you and you feel seen and cared for. That is so important. And I think you do also point out a very important fact that because you are in a city where there are available options, you are tremendously fortunate. And I think that for those patients who are maybe living in a rural area and do not feel seen, I mean, it is true, they have limited options, but there's also telemedicine. There's also coming to events like this to talk to experts and understand kind of the scope of your disease and feel seen and heard in different ways. And I really would encourage everyone to seek out every option. And so thank you for sharing that. I wonder, Dr. Choi, if you could share with us some thoughts from, I guess, a physician healthcare perspective. When a patient doesn't feel seen or heard, what would you recommend to them?
I think just do what Uneka does. I mean, she advocates for herself. I mean, this is kind of a model for how you should approach your healthcare interactions. It's not that you have to see this doctor if you don't like them, right? You have a choice. And there's so many doctors, I think, that do NMO now in our area that are very good, but you may find someone personality-wise doesn't fit. And so it should be an interview, and you should feel empowered to come with information. And I would say that the more organized you are as a patient approaching your doctor, the better. Like if you have all your information ready and you're not in a frame of mind where you're angry, or, oftentimes if you're waiting for an hour, you're angry, but you want to kind of maximize that 30 minutes with your doctor. So you really want to not only interview them, but present your best information to them in an efficient, comprehensive manner. So I think the way that Uneka approaches it is very good. And I would kind of model my interaction as a patient like Uneka does.
Okay, thank you. And yes, Joanne.
Can I add something
Please.
to what Dr. Choi said? I think it's important as well that whenever you go to the doctor, try to keep a diary, because not everything happens at the same time. And sometimes you will forget, like me. I suffer from brain fog and everything. So I feel like my brain is not the same as it was like 10 years ago, even. So try to write those symptoms. Try to keep a detailed diary of what you're experiencing. And that way, whenever you go to the doctor, you have like a clear picture of what's going on with you.
Yes, thank you for that. And I think, again, you're speaking to self-advocacy and patient empowerment, which is so important. And it's interesting you should bring that up, because I know that you have a sister who has really been supportive, and that could also be hugely advantageous when you go to the doctor. And this is probably for everybody, that there's so much information at that one visit. Having somebody there with you who's maybe not sort of like, who could be more sort of objective and write things down and ask the questions that you have been thinking about and set aside those details is so valuable. And I think your sister's been a huge advocate.
Yes, she has. And she's a good clinician and a great investigator as well. She works at NIH right now. So what happened is that I feel like whenever she's in the room, it's a different experience as when I'm alone with the doctor. Suddenly, like, there's more respect and listening more carefully about what she's saying that I'm experiencing. Maybe I don't have all the lingo and all the nice words that you guys use. So whenever she's in the room, the energy shifted, right? I had an experience where I was in the ER. It was New Year's Eve, and I was really sick with COVID, and my limbs were like very weak as well. The nurses tried to put IV on me without gloves. They tried to get me to do urine tests, and the bathroom was filled with blood from somebody that had a fight. And it wasn't only one nurse trying to put medicine on me without gloves, or they come with a bag and try to hang it and touching everything without gloves for a patient that's immunocompromised. It was like several of them trying to get somebody that was higher up or a manager of the ER to come and talk to us was almost impossible, until my sister got really fed up and and involved the Joint Commission, and they didn't know that she knows the system. So having somebody that knows the system sometimes is a great power. having somebody that knows how to research and do good research, not like somebody mentioned before, like just Google and get all this misinformation, but peer review research is something that's really empowering. And not everybody has that. Nobody has. Not every patient is in the right state of mind just to advocate for themselves because you're in pain, you're having plasma exchange or whatever, and whatever other treatment that you're doing.
Yeah.
So that's something that sometimes it's conditional, the respect that you get from the healthcare system, and it shouldn't be like that. But that's what we experience.
Yes,
So
exactly. Oh, go
Can
ahead.
I add something to that? I think one of our main barriers or limitations is that as a healthcare system, we are not centering in the patient. We are centering in the disease, we are centering in the doctors, in many other different factors, but we are not focusing on what are the needs of the patient. So in Georgetown, we claim to be a patient-centered practice, and what we try to do is kind of like focusing on what is important to the patient, right? Like, is it being on a medication to prevent relapses, or having a quality of life by other means, or like it's not like having one disease fits all of the patients, right? Every single experience is completely different. So, for example, for Uneka, she's a great advocate of herself, and she is very successful of achieving her priorities. Whereas for Johane, things are quite different because she needs someone else who helps her. So how good are we as providers to include the family members, the neighbors, the rest of the community to try to help us take care of the patient, because we won't be able to pick them up and bring them to the appointment. We won't be able to go to their houses, right? I wish we could go to the houses. Sometimes I'm like, I wish I could go to my patient's house and talk to them in their environment and see what's going on, because that will help you to understand better why they are doing things that you don't understand. And the first reaction will be just denial and be like, oh, I try everything I can, right? But if I'm not doing a patient-centered approach, then it's just kind of like it's a failure from the start, right? Like, so.
Wow, I really love your dedication in wanting to know your patients and understanding their sort of unique perspective. And I know, well, correct me if I'm incorrect, I know you mentor medical students or physicians or fellows, perhaps.
A little bit of everything.
A little bit of everything.
Some fellows,
Yes.
some
I wonder,
students,
what are you sort of doing to help them understand how to be that physician when they go out and practice?
Yeah, so that's one of our challenges, because in med school we don't have a curriculum for that. So I wish we could like have a single like 6 months course when we kind of like focus on how to become a patient-centered physician, right? So we barely like have some topic that they talk about with communication skills and how to focus the interview, but it goes way beyond that.
Yeah.
I think that, I always wonder about what the term entails, right? Like, what is it to be a patient-centered? Because there are so many different factors in a human being that determines their outcomes, right? So it's quite challenging, but I think that the more we are able to address what that specific person is struggling with, the better care we'll give them. Right? We will be able to provide for them. So,
Absolutely.
So that's kind of like the main message I give to the students when I have the students. Yeah.
I'm sure that's really helpful. Thank you. Did you want to add something?
Yeah. Listening to you, thinking about, who my team has been, one thing I would say is that representation in the healthcare system contributes heavily to this conversation.
Yep, we talked about this.
I'm so appreciative to have doctors of other races, ethnicities, cultures kind of be infused in this process, especially for a disease that's so rare, because it helps me to feel less uncomfortable, right? When I see that these are people who are different like me, they don't fit a particular profile. No offense, they're not just some white doctor who's coming in and telling me all of these things. And I'm like, well, what do you know? I mean, yeah, there's an MD behind your name, but like, what do you know or can understand about my experience as a woman, as a Black person, as a young person? Some people think I'm too young to navigate this disease. Meeting Nell today, I'm like, come on, guys, how young is really young, right? To really have to, be in a position to navigate this. But being able to see the diversity just in this field helps tremendously. And it shows patients that their people, like their tribe, their community cares enough about them to, go on, firstly, be a doctor. It's huge deal. Everybody here, doctor, nurse, practitioner, whoever you are, thank you for your service, because it is a sacrifice that you make.
Agreed. Thank you for that. I think, Johane, you wanted to add one more thing?
Yes, speaking about the doctor and patient relationship, wanted to point out that that is important, as you said, get to know the patient. But like my most recent experience on the ER and the hospital after COVID was like, where are the doctors doing rounds? And I don't know if it has changed everywhere or because they were doing rounds before. I'm a professional patient. Let's be clear about it. Before they used to come into the room, all the students, the doctor, if you were in a hospital where they have the students or whatever team that they had. And after COVID, I was like, where are the doctors? Hold on. And they were monitoring my progress or whatever, talking outside the door. So I'm like, how are they going to treat me if they don't even see my face? So it's important that you go into the door, that you talk and say, good morning, I'm your doctor, or whatever. This is our plan for today.
I think somebody agrees with you out there. Yes, thank you. Yes, thank you, everybody. I know our time is up, but can we open it up for one question or two?
Sure. Not a question. I just want to say, at Georgetown, doctors come in the room. They give you their name. They talk to you as your human. And so do the nurses and the aides and everyone. I switched all of my doctors, all of my treatments to Georgetown.
All right. Go Georgetown. Thank you for that.
Yeah, quick shout out to all the nurses. I just want to do one more shout out. I would be remiss if I did not shout out Nurse Tracy. She is the absolute best in the world. She's also my birthday twin, and and she makes my experience truly great. Truly. She's just great. She's just
special,
yeah, amazing, right?
Awesome.
All of the things.
Thank you for our amazing panelists. Unless there are other questions.
You guys have heard from me a little bit, but I love this conversation, and I just wanted to just sort of add one other thing from both a parent and a physician perspective, which is to say that we are all lifelong learners, like as physicians, and I just want to point that out, that we are learning all the time. We're reading up on diseases, we're keeping up on studies, but we're also here to learn from you, and our students are here to learn from you. So, at Children's, we work with all different ages of medical students and residents and fellows. there's only so much I can teach them about like what the disease is, right? I can teach what the treatment is. I can teach those types of things, but you guys are teaching them too, and you should recognize that you're part of their education. They're here for you, but you could also be there to say, you know what, I appreciate that you're here, but the way you said that to me didn't quite land. Or what you said was great, thank you. And you came up and you introduced yourself to me, and that meant a lot to me. And those like one-on-one experiences that they get as students and as learners, and us too, really stick with us and I think help us become, again, better physicians and learners too.
Anyone else?
I just have a quick comment. I wanted to say thank you for your time and for the space and for letting us continue to listen and learn. Achieving health equity doesn't come from everyone with a seat at the table, so I just want to say thank you for telling your stories and for sharing your voices. Thank you. I appreciate you. Thank you again.
Thank you. Let's give it up for our panelists.